It's like, hello, everyone. It's Dr. Tamara Beckford, and welcome to the Dr. Tamara Beckford Show. Alrighty, so we're going to talk about this word. Have you ever heard it? Matrescence. Ooh, look at you. You're like, what? Okay, so we're going to talk all about this now, what you need to know. Now, this is a process of like becoming a mom. There's so much that happens during that period of time. But number one, half of us have no idea. We want to be part of that process. We want to, start our family. We're excited when we're on our way. And then we're like, wait a minute, really, what does this entail? There's so much. There's this emotional portion, there's a psychological portion, there's the social, all these changes. And that's what we're talking about today with our guest. All right. So this wonderful Dr. Mom of ours, Dr. Mom Entrepreneur, Docpreneur Mom. Yes, that's what we have. She's a graduate of the Chicago College of Osteopathic Medicine. She did her residency in family medicine at St. Paul, Minnesota, or in St. Paul, Minnesota. She's also fellowship and board certified in integrative medicine and breastfeeding and lactation medicine. She is the founder and CEO of Fourth Trimester Doc. She has this private practice that provides in-home medical care for our fourth trimester women and beyond. She uses her extensive training in perinatal mental health, complementary and alternative medicine modalities. She does yoga, mind-body medicine, food medicine, and manipulative medicines training to help her patients and her clients. In addition to all of that, she is also a coach for postpartum women and the co-executive director for a nonprofit that's named Center for Fourth Trimester Care. That nonprofit provides professional support for healthcare professionals who are working with families in the fourth trimester. Who am I talking about? Who are we bringing it on? It's Dr. Michelle Haggerty. Woo!
Yay!
And we're bringing ourselves on. I don't have my applause button today, but I'm like, all doctors need to come on in a round of applause. So that's all the noise that we're having. Thank you so much for joining us, Dr. Michelle. How are you today?
I'm great. Thank you so much for having me. I'm really excited to be here.
Me too. Alrighty. So we're talking about matrescence. And as I mentioned to you behind the scenes, I was like, matrescence. Now, I've actually never heard that word before, but I am a Latin scholar. So, for those of us who studied Latin or did Latin in any form of our training, we know we break every word down. So I knew what it meant. I knew what the essence of it was, but I'm really excited to talk about this later on. But before we get deep into that, let's find out a little bit about you, Dr. Michelle. When did little Michelle decide, you know what? I want to be a doctor. Tell us that story.
Yeah, I wasn't actually very little when I figured it out. So I went to college and got my undergrad in nutritional sciences. So I thought I was going to be a dietitian originally. And yeah. So I was really into sort of health and nutrition in general. And my focus was actually on infant nutrition, interestingly enough. So breastfeeding and lactation and infant nutrition started off sort of early on. And then I went and got my master's in public health, which focused in on nutrition and global health, and again, sort of expanded on that nutrition and global health aspect of specifically around infant nutrition. I think so. Actually, in college, when I was going to school, I was going to classes all with the pre-med students. So I'd done all like the prereqs with everyone. So I sort of done it all already.
Right.
And so it sort of felt like sort of natural to kind of go through that process. And I'd actually done like the MCATs and things like that, just because everyone else was.
Okay. So we do MCATs for fun now. Come on, Dr. Michelle.
I was like, well, I wasn't entirely sure. I wanted to keep my options open, right? So I wanted to give myself all the opportunity. But I wasn't sure I really wanted to jump into, med school. Absolutely. So got my master's in public health, loved it, loved the experience, loved being with the folks I was with. I thought it was just so amazing. And then in that experience, I did some study abroad stuff. And while I was away, I sort of realized, wow, I think medicine is for me. I actually want to be a teacher is what I thought. I want to be sort of a supporter and teacher when in the medical field, really.
Right.
And so medicine then sort of became the next step. So
I
I did
love it.
residency after that, and or medical school after that, and then residency obviously after that. So
Wow.
yeah,
Okay.
yeah,
So here we are.
here we are.
Now, actually, you're the second doctor that I've interviewed that was food and nutrition dietitian and then went into medical school. Dr.
Mhm.
Basma Faris. I don't know if you know her.
Yeah, yeah, I've
Yeah,
heard her.
yeah,
Yes, yeah,
that's it. Yeah,
mhm.
both of you guys were did that. So and also she did teaching too. Look at you.
Yeah,
Wow, there's like this, yeah, there's a lot of correlation with that.
yeah, love it.
But I love the fact, and I've never really thought about it, which is very interesting, that you did the nutrition for infant nutrition. Because and you're actually the first person I've ever spoken to that I've heard that has gone down that specialty route, like in dietitian prior to
Mhm.
medicine and so on, which, obviously it's very, very important because those first few days are so important. And as we'll talk about during about the support and all the psychological changes that goes on when you become a mother, that's one of the biggest things. How's my kid, like, are they eating, like, oh my
Yeah,
gosh, like,
yeah,
am I
yeah,
producing enough, they're sucking, are they getting anything?
right.
So I love the fact that you have that background in that infant nutrition, and like, to the point that it's really such a big focus, and you can help ladies later on with that as we'll get into the conversation. So you're there doing that, and then you're taking MCATs because you're taking all the classes,
Right,
you
right.
go abroad.
Mhm, mhm.
I love it. But you're doing, like, some traveling international work. And that's when the realization hits you, like, that, hey, with all the knowledge that you've gathered, you wanted to put it all together and be able to help in an additional way and through
Yeah.
medicine, and came back and applied to medical school.
Mhm,
And then you're in med school in Chicago. And like
mhm,
I said, and asked the question that I ask all of my guests, there are so many specialties, but you chose family medicine.
mhm.
So what brought you to that? Like, what pulled you into family medicine?
Yeah, there was actually a moment for me, which
Oh.
is sort of fascinating. I was on my OB rotation, so I was
Mm-hmm.
attending births, and it was actually like the first or second birth I was at, and caught the baby, and then at that point, they were still bringing the babies like over to the warmer. The baby wouldn't go onto the
Mm-hmm.
mother's chest, and so the baby went over to the warmer, and then I stood in the middle of the room and couldn't figure out which direction to go. Do I go to the infants? Or do I go to the side of the mother? And I was
Yes.
like, I can't decide where I need to go. And so family medicine was like, I have to do both. I have
Yes.
to be both.
Oh,
So
wow.
it made sense, right? Like sort of at that moment. It's like, I
Mm-hmm.
can't choose just pediatric just for me,
Mm-hmm.
pediatrics without being able to sort of support the maternal side. And I can't choose just obstetrics because then I'd be missing out on the infant side of things. So it was family medicine was the only choice, the only route to go
To be able to
to do
really
both.
satisfy both of that
Yep.
passion that you have inside. And can you
Yep.
imagine that mental, I wouldn't want to call it turmoil, but that tug
Kind
of
of.
war
Yeah.
that was
Mhm.
going on during that time? Because as a student, you're like, you were on your OB rotation. So your OB is like, ma'am,
Yeah,
could you
it's
get
over
back over
here.
here?
Right, right. I'm like,
Ah,
yeah, yeah,
but the
yep.
baby,
Right. But hey, man, I want to see what's. Can I just? Yeah, yeah, yeah. Exactly. Yep.
wow, I love
Hmm.
it. And I love
Yeah.
that, you're able to pull in that passion and you put it inside of you, and it gave that spark. Because
Hmm.
to be able to really go after something that is a passion, that really is able to fill all the boxes that you have inside of you, to say, I would love to be able to do this versus that, and to not feel as if you left any part of you out, to keep
Totally.
yourself
Yes.
whole. It's beautiful. Alrighty. But in true fashion, you didn't leave anybody out,
You're right.
because
No.
after that, you did family medicine. Then you went
Yep.
ahead and you have
Yep.
so additional training and fellowship, breastfeeding, lactation. So there you
Mhm.
go. So now the baby's over there. You were able to help the baby,
Right. Yep. Yep.
integrative
Yep.
medicine, and so
Mhm.
on.
Yep.
And when did this portion of matrescence come into you? Let's first tell people what this is, since I've had them in a cliffhanger and they're
Yeah.
probably
Yeah.
like holding on by a nail now. What
Right.
is
What
this
is this?
matrescence
Yeah.
that Dr.
Yeah.
was talking about? Tell them what matrescence is.
So matrescence, I love the so if you when people are trying to figure out how to say it, so it rhymes with adolescence, so that
Mhm,
helps people sort of figure out how to say it,
mhm,
and it's very similar to adolescence in that, like you talked about in the beginning, it's all of these changes that happen in this very specific time period, right? So like the hormonal changes, the spiritual changes, the relationship changes, the way you present in society, your environment. There's actually like brain changes that shift, and like there's all of these things, emotional, right? All these things that shift, and we're fairly familiar with what happens with adolescents, and we sort of are supportive as a society and supporting those folks. But it's really misunderstood, not well studied. There's not a lot of research around it, and really under-supported in that matrescence period. And so it's something that is just needs to be brought to the forefront. And so people can really, and when I talk to people about it, they're like, oh, that's what's happening to me. Like, oh, wow. Like they're just so, this is, it sort of makes sense, it makes sense for people. The term was actually coined by Dr. Dana Raphael, who in the late 1970s, and she actually coined the term doula as well. So she's sort of this inspiration and instrumental in the birth world in general. And then it was like just went dormant for a while, and then Dr. Orly Athan, who is a psychologist out at Columbia, she then sort of revived the term and did like talks and courses and things to try and teach people about it. So that's sort of where it came back. And that was in the early 2000s. And so now it's sort of just coming into more and more of the mainstream, and people are starting to understand and appreciate it more. So, yeah.
When you mentioned that it rhymes with adolescence, and then we have started to feel more comfortable with all the changes that happen with someone going through adolescence, to be able to say, okay, you'll find these changes, these 3 changes, we'll put them in category, and it's not just table talk between you and your friends. It's not just a table talk or where mom or coffee talk or tea talk, right? Where mom is telling you, oh yeah, you might feel this, or auntie tells you, yeah, I went through this, and my cousin, but you're really able to categorize these changes that's happening to your body during this time. And the changes are physical, emotional, and you also mentioned spiritual changes that goes on. But to be able to categorize it and have it formalized, that is true statement, in that we really haven't done that for a lot of our changes, especially that's happening with women. We have the menarche, like, okay, you're getting your period.
Well, and that's really I talk about the 3 M's that are really misunderstood and misrepresented in society, and that's menarche, matrescence, and menopause, right? These 3, yeah, exactly.
So menopause, we're starting to talk about it a little bit more, but matrescence?
Right. No, exactly. So yeah, they're very, there's these huge hormonal and huge big, just shifts in general that happen in our lives that just have not been well supported, really. Yeah, exactly.
Wow. All right. So now you have me down a rabbit hole, because now I want to know more. All righty. Yeah. So what are some of the first things that one should be aware of with matrescence? Like we know that there are categories, it fulfills these things, and it's not well understood. But when we're talking to someone about it, what are some of the first things that we really highlight for especially a woman who is entering into matrescence?
Well, I think that the first thing is really defining it. And there's been some focus on it just being sort of postpartum, but I really think it starts when you're even thinking about becoming a mother, like even before you even start sort of trying, or even through the fertility years. Even people who are going through infertility, for example, are still going through this sort of matrescence shift. They're shifting the way that they maybe eat, the way that they care for themselves. There's sort of like a different shift in their mentality. There's the shift with maybe their relationship with their partner and even other people in the world. So really it starts very, very early on, much earlier than I think than even what we would consider sort of the birth of the mother, right? Like the time at birth. Even people who have gone through miscarriages, for example, like they're still, in my mind, still a mother. Like they've had that, that experience of having that little one sort of in there. So and having that mental shift of, like I'm taking my prenatals. I'm planning for the future. I'm doing all these things that, you wouldn't be doing otherwise. So yeah.
Yeah, that is a great statement. And I actually, as you're saying this, I remember when my shift happened, it was like a switch, which I don't know if like not everyone feels this way. But I recall during, a lot of us who are doing careers that require a lot of energy, emotion, time away from really starting families, especially career, like us women, I'm talking specifically now. I remember when it's like, well, are you ready to start a family? No, no, no. And then I remember one day
Mm-hmm.
it just became yes. It was like the switch
Yes.
just went off. And I'm like, I'm ready now.
Mm-hmm.
And you're
Mm-hmm.
right. Once that switch goes off and you're saying that, okay, I am ready, my mind changed. And
Exactly.
a lot of things changed. The way that I approached life changed. The way that, like you said, approach food, approach, prenatal, preparing. It's almost
Planning
like
vacations even. Like,
planning.
what happens if I
Oh,
get pregnant and I can't go on this big vacation at some point, right? There's like, and
that
there's
is a
all of
great
these things.
point. That
Yeah.
was during the
Yeah.
time of the Zika virus, and
Right.
I specifically did
Yes.
not go abroad because I didn't
Yeah.
want to get
Mhm.
pregnant during that time.
Completely.
Wow, that
Mhm.
is such a great point. There's so much that happens, but we just put it off to say like it's just happening, but we're not categorizing it that that's really a change in how we are living our lives because we want to prepare ourselves
Right.
for and we
Yes.
want to be at our optimum, right?
Yes. Right. Exactly. Yes.
Yeah,
Yes.
there are women who are they might want to shift like their body habitus in order to prepare themselves to be at the best
Mhm.
state, to have the healthiest.
Mhm. Yeah, or even medication shifts, right? People change
Yes.
the medications that they're taking or start
Hmm.
talking about, what that looks like for, during the pregnancy and beyond. So yeah, there are so many things that, that sort of go through your mind when you
Hmm.
start thinking, oh yes, I'm wanting to or will in the near future, when you
Yeah.
start thinking about having children. People change, they move, they move into different school districts, they move into to be closer to family, right?
Yes. Hmm.
So they're like preparing all of that. There's all of these aspects of our lives that we, maybe the career, maybe they start going to part-time or they look into, is that a possibility? Do they
Hmm.
need to shift to a different job that will allow that, or not, whatever that looks like. So, I mean, I even had to sign up for daycares prior to getting pregnant because there was,
Yes. Yeah,
it was,
because the wait
yeah, the
list
wait lists were an hour
was
or a year and a half long. So like,
yeah.
yep, we had to like get the daycare, get on the daycare list. So like, I mean, we were already planning for that. There's,
Yeah.
yes, exactly. Finances,
Mm.
right? Like you
Yes.
start saving differently or
Hmm.
putting a fund away for that. So
Hmm.
yeah, or even signing
Absolutely.
up for different health insurance, right? Like I want insurance
Yes.
that will cover this place or something. So
Yes.
there's a lot of things that people start shifting that we don't really acknowledge, I think, or that
Hmm.
society really acknowledges in supporting people as they're going through that. So yeah.
Hmm.
Mhm.
Yeah, I remember even during the pregnancy itself, I'm a doctor. I know other doctors, especially I do emergency medicine. So I really talk to a lot of other people. And I had to sit and I had to figure out, like, wait a minute, when is the best time to get a pediatrician?
Right.
Is it,
Yes.
you
Mhm.
know, and how do I make this appointment? Because I'm
Mhm.
pregnant,
Right.
so I don't need them yet.
Mhm.
But when I leave the hospital, like even just during that period, like
Mhm.
what happens? How do I do this? There are a lot of questions. And as you mentioned, even with medications, women, there's some women who are on meds for autoimmune issues.
Right. Yes. Yes. Exactly. Yep. Yep. Mhm.
And yeah,
Mhm.
wow,
Mhm.
there's a lot that goes on. Alrighty. So now if we really think about it, now that I'm really diving into this rabbit hole, because
Right.
I just did it.
Mhm.
But I even changed it because I had hyperthyroidism and I didn't
Mhm.
want to go into thyroid storm.
Yes. Exactly.
So I
Yes.
was
Right.
afraid of that during
Mhm.
pregnancy. And so I got an ablation because I said
Mhm.
hypothyroidism is easier to manage.
Right.
And this is
Yes.
what I did prior to because I wanted to start a family.
Exactly.
Blowing my
Yes.
mind now.
Yes. Yes. Right. Exactly. All of the
Wow.
things. All of the things. yeah, so shifts that happen, right? So, and so for me, I really dove into this when so I had a miscarriage was my first pregnancy, and I was for whatever reason it felt like it was a miscarriage, meaning that they didn't, I went in for an ultrasound, a standard ultrasound. And they found out that there was no heartbeat, and so they gave me an options. Do I wait? Do I get a D&C? Do I take medication or whatever? And for whatever reason, my body and my brain kept telling me this feels toxic, which feels strange. Like, what toxic? Like, why does it feel toxic? I was like, I need to get this out immediately. This is not. We need to take care of this. So I got a D&C a couple days later, and they of course sent the they sent it to the pathology. Yeah. Yep. And the results came back that it was a partial molar pregnancy. So meaning that I was at risk of having cancer then from this pregnancy. So thank goodness there was nothing on the ultrasound that showed it. Like we talk about like the grapes and whatever, like there was nothing showed, like, the haziness, whatever. Nothing showed that on the ultrasound, but the pathology showed it. So, so then I had to go in every single week into my OB office and have my HCG checked, which is like my hormone level checked. Every single week I walked into this clinic and sat there with other people who were pregnant. And like for months, every week. The hormone level's not down yet. The hormone level's not down. We just got to keep checking to make sure that it wasn't cancerous. So that the hormone level didn't increase for whatever reason. And so like this was torture, absolute 100% torture. Like I would never wish this on anyone. Right. So then finally hormone levels came down. I was able to then start trying to get pregnant again. Luckily got pregnant fairly soon afterwards. Ended up having a healthy pregnancy, healthy birth. And then went home after the birth and was like, they asked me, you had schedule a pediatrician appointment a couple days after the birth. And I was like, like, are you kidding me? I'm in diapers myself. I'm completely incontinent. There's no way I'm putting pants on. And you're telling me I got to bring this baby into the clinic? Like, I can barely walk. Like, what? And I was like, no, this is not happening. You've got to be kidding me that this is the way. And it's so just this light bulb moment of like, this is the way that we treat mothers, women, birthers in this country, right? So that who cares about you, the vessel that carried this baby? We only care about the baby now. We did all of these visits, all these things up until this point. We cared a lot about you and the baby up until, the birth. And then after that, we'll just see you at 6 weeks. Cool. Yeah. Peace out. Good luck. Right. So
good job carrying that vessel.
Right. Good job. Like you did what you needed to do. Nobody else, like your bodies did what it needs to, and that's it. And I felt like I got hit by a train, right? Like I was like, this is crazy and nobody's going to be following up, checking in on me or doing anything. And so I realized as a family med doc, I was essentially doing this to my patients day in and day out. Like, we need you to come in. Like I was obviously asking the mother how they were doing, the brother how they were doing, but it wasn't there. Those appointments weren't about them. They were about the baby and, making sure.
And you were like, by the way, so are you okay?
Yeah, you okay, like, how are things going? Good. Okay. Like, we'll see you at the next baby visit. Not like, do we need to see,
Yes.
I would screen, make sure that mental health stuff was okay, but like, it wasn't that really in depth. And these were 10-minute visits. Like, how do you get anything in depth with that? So that's when actually soon after that I started doing the Integrative Medicine fellowship and found out about all these other practices that are outside the system. Like, wait a second, you can do like coaching, you can do like these lifestyle medicine, practices, cash-based or membership-based or direct primary care, concierge, all these things that in medical school we were never taught about. We were never told about options. We were going to work for a clinic or a hospital and we were going to be employed and that's it. Nobody else, we were not going to be employers, right?
Yeah.
And so it opened my eyes. I was like, wow, wait a second. There's a possibility of some other world out there essentially for me. And so that's when I started dreaming up my private practice and realized, like, wait a second, what I want, like what I feel like I need for myself, I could actually provide for other folks. Yes. And so that's where fourth trimester doc was sort of started.
I love it. It really started like in the need that you recognize there's this gap. And I love that a lot of our doctors are realizing like there's a gap that's going on here in medicine, and I can fulfill that gap.
Yes.
And it doesn't have to be the traditional way.
Mhm.
Because just as you mentioned, we're really taught a lot of traditional things, pass it on and this.
Yes.
And thank you so much for coming to med school to go out there and go work for this. Good job, guys.
Yep, right.
But there are gaps that are happening. There were gaps before, and there are a lot of new gaps that are there because it's ever changing the way that we see medicine, the way that we're practicing medicine. It's changing now and there are areas that need fulfillment.
Yes. Yep.
And this portion definitely is one. And if you go all the way back in time, you're right. We're the vessel.
Yes.
And after you finish, there's a little bit of care for you, but it's a 6 week. It's, but baby is needed, of course, in 2 days. But in between that, there isn't really that much. It's like, go lay down and heal. And then we're realizing the need to be able to provide more. In addition, screening we have, thank God now, because for a while we weren't screening our women, right? But now we have the screening, but there's still so much more. Like you said, your body's healing. There's so many changes. There's physiological, there's emotional changes that's happening. How about the realization that now I'm no longer that, like, if you go from not being a mom to now being a mom, the realization that you're no longer just it's you and
somebody depends on you. Yeah, exactly. Yeah. Like everything is like, and you're so interconnected, right? So there's the health of the birther or the mother is so dependent on the health of the baby, and vice versa. The health of the baby is so dependent on the mother. So like you're not really separated, even though they're outside the womb at that point, right? And you can feel that, like there's just that super connection there that you can't really separate. And it's very overwhelming. It's absolutely overwhelming. Yep.
Yeah. There are a lot of women who, like me, I didn't sleep for the first week. I sat up with the baby.
Right. You sat up. Exactly.
And I just sat and held him. And I was like, all right, he's breathing now. Okay, he's good. Okay, he's breathing. And so, but that's not healthy. Can I sit up for the rest of my
No, exactly, right. Well, and the scary thing is that the maternal mental health and also maternal just health crisis in this country in general, right? So we have the highest maternal mortality rate in this country, and I don't know if you know this, but over 60% of maternal deaths happen postpartum. So the majority of deaths are happening postpartum, not during the pregnancy when we see people a million times, not during the birth, which everyone is so focused in on, and all the interventions and things like that. It's postpartum. And it's up to a year postpartum.
Oh, wow.
So this is when people are dying. This is when the need is there. And yet we're only seeing people for that 1 6-week visit. Maybe for the 2-week visit, for a 2-week visit as well. Some people are seen for. But yeah, so that's scary. And then on top of it, the research has shown that over 80% of those deaths are considered preventable. So if somebody laid eyes on that person, if somebody laid their hands on that person and like listened to them and check their physical, how they're doing physically, check how they're doing mentally, all the things, then we would be saving lives.
Wow.
But we're not seeing them. We're seeing them at the 6-week visit, and that's it. And then letting them go on their way.
What are some of the top reasons for these deaths? I know when people hear this, the first thing that's coming to their mind is the psychological portion, where is this postpartum depression is leading to death by suicide or things of that sort. But I can imagine, based on what you're saying, that alone is not it.
Yeah, no, it's not.
Yeah.
In general, the mental health is one of the top, or is the top if you look at overall statistics over all population. But for example, for Black mothers, it's cardiovascular issues. So it's things like thromboembolisms, cardiomyopathy, cardiac issues. So like it's not, you can't just sort of categorize, into one area really with that. So it's all like it's all of the above, really. It's mental and physical that we need to be focusing on and supporting.
Wow. That's really, it's jarring, the statistics, and recognizing that some of this, like you said, is preventable if there is a little bit more focus on the women during this period.
Yes,
not just the pregnancy because and that's what we're talking about when we're learning about the gap, and how we have our doctors who are now aware of the gap and being able to focus and fulfill and change what's going on.
Yeah.
Because had we not, we'll still be practicing the same old medicine where,
Exactly.
hey, prenatal, we're worried about, and then postnatal, it's just about the baby and
Yeah.
one or two check on mom.
Mhm.
But to be able to catch what's going on during that time, especially like we said, that 1 year afterwards, where there's such a high risk that's going on, it's now important that we even start focusing more. And
Yeah.
I'm happy that we have doctors like you and like some of our other doctors out there that's really focusing on fourth trimester,
Mhm.
which before it was just like, well, why are you worried about that? It's just the first 6 weeks. After that, it's like, okay, well, keep it moving. But
Right.
there's
Right.
so
Right.
much that's going on, and like we're talking about mortality. We're talking about changes. We're talking about there's a huge shift that happens in the dynamic of that person's life,
Mhm.
even if
Exactly.
it's the first, even if it's the second, the third, the
Yeah.
fourth,
Yep.
no matter
Yep.
what, there's a shift that's going on, and it's important for us to really recognize and to take heed and see how we can support these moms.
Exactly.
Wow. Alrighty, so with that, I can see why you started your
Right.
practice.
Yeah.
Yeah, this
Mhm.
is definitely
Mhm.
a huge need. Now with the practice, you also added on coaching, and then you have these other modalities that you're trained in, like
Mhm.
yoga and food as medicine, and then also manipulative medicine. And
Mhm.
this OMT, is this
Yes. Yeah.
yes,
Yep.
already. Let's
Yep.
talk a little bit
Osteopathic.
about
Yep. Mhm.
let's talk a little bit about that, because people are still not completely understanding the
Mhm.
skill set and the highly training that goes into osteopathic medicine. So just kind of give them an idea of what does the osteopathic manipulation and how you use it on your patients.
Yeah, so osteopathic manipulative medicine is I'm trained as a DO, which is
Mm-hmm.
considered a doctor of osteopathy, and
Mm-hmm.
we have the same training as MDs as far as like sort of the anatomy and physiology and all the background on medicine and psychology and pharmacology and all the ologies, right?
Right, all the
Um,
ologies.
all the ologies. But then we also have additional training in manipulation. So some people kind of think about it like similar to a chiropractor. Like we're manipulating the tissues. We don't just do the skeletal the skeleton itself, though. We do like the fascia and support the musculature and the lymphatics and things like that as well.
Mm-hmm.
So we use our hands to heal, which is and
Mm-hmm.
diagnose as well. So it's really sort of a lovely training to be able to have. And so we would spend every Wednesday morning in medical school where we'd go and manipulate each other, and it was great. It was awesome because you'd have a little kink in your neck and somebody would fix it.
Yes, I love it.
And but yeah, so for me now though, it's a
Mm-hmm.
really fabulous skill to be able to use for infants and the birthing people as well. So infants, I do a ton of manipulations for like with torticollis, for example, or if there's
Mm-hmm.
issues with what we call tethered oral tissue or tongue ties, we can do some manipulation there to help with releasing some of the restrictions. Even just helping with like if they come out of the birth canal really fast, or if they come out really slow and kind of stuck, like they're just helping those infants kind of come back out into the world and feel like they can sort of move more easily.
Mm-hmm.
And then similarly with the birthing person as well, so helping them with sort of the adjustments needed to help with feeling better in their pelvis and things. And then I
Mm-hmm.
also use it a lot with lactation too. So there's things that we can do with helping release mastitis, for example, or inflammation in the breast tissue,
Mm-hmm.
helping with low production. So if they're having low milk production, we can do things to help with supporting that as well. So I use it quite often, quite frequently.
Wow, I love it.
Yeah, it's great.
When I'm thinking, I didn't think about it for, of course, I thought about the manipulative treatment for pelvic, and
Mm-hmm.
because there's so much changes that's going on in the
Yeah,
pelvis,
totally
right?
right. Yes,
Oh
yes,
my
right.
gosh,
Yep.
it's changes, and then there are discomfort
Mm-hmm.
that's afterwards.
Mm-hmm.
But then with the milk production, I did not realize that using even this training that you can help to with the supplies? What is the modality for that to be able to help with the milk production?
Yeah, so
Because
you can
that's
help with,
something that people, if they knew, I'm pretty sure that they would be
yeah,
flooding to come to
right,
see you
right,
for
yeah.
that.
Yeah, so it helps with with blood flow, for example. So if they have
Hmm.
really tight pectoral muscles, which a lot of people do because they're like breastfeeding like this all the time, right? Like their shoulders are
Yeah,
hunched forward, they're kind of leaning forward, they're holding
absolutely.
their
That
babies
was
like
me.
this, right? So a lot
Hmm.
of this is happening this way. So they have really tight pec muscles then,
Hmm.
which then affect the sort of blood flow, right?
Yes.
From sort of centrally toward the
Hmm.
breast. So yeah, so it can help with that quite a bit, and then also just allowing things to sort of open up and be more
Yeah.
comfortable, which
Hmm.
can help with people being more comfortable with lactating as well. So there's
Yeah.
yeah, it's a great
Fascinating.
skill set to have. Yeah, yeah.
Fascinating. Fascinating. Alrighty. So now, with all this put together, right? During matrescence, what would you say would be like the top three things that you would tell someone who is now entering into matrescence? Didn't even know about it, but they're entering into matrescence to help to make it as comfortable as possible or for as smooth as possible for them. I know that it's always an up and down, but
Great.
this is a great advice that we're giving to our people out there.
Yeah,
Yeah.
you want to give tools, right? So
Hmm.
so setting people up for success. And I think
Hmm.
the one of the biggest things is actually planning for postpartum. So I talk about planning for postpartum, or I'm sorry, the planning for the birth and not postpartum is like planning for a wedding and not the marriage. So it's like
That's true.
the big event is
Yeah.
a big deal, right? Like and that's a big deal. We want to sort of plan for that. Honestly, the birth is a lot of that stuff is sort of out of our control in the first place. So
Yes.
like all the plans itself are we can kind of do what we can, but there's a lot of things that just sort of our bodies just do.
Yes.
But the postpartum time is when you really need to be planning for all the things that so to set yourself up for success. Set the cards stacked in your favor, right? So
Hmm.
we want to do things like where are you going to get your food from? What's nutrition going to look like? What's movement going to look like? Who's going to be your support system, both professionally and then also that your friends and family and things like that.
Hmm.
What's your environment looking like? What are the things that will help you be able to heal and rest
Hmm.
and be able to focus in on really your main job is just keeping that baby alive. You're
Absolutely.
everyone else should be helping you, and your job is to sort of like focus in on that baby.
Hmm.
The other thing I think people forget about is that when after they give birth, they have a wound the size of a placenta, so a dinner plate on the inside of their body. That's what they're bleeding from. And so
Hmm.
they think that, I can get up and go to Target, 3 days postpartum. And I'm like, no,
Hmm.
if you had a wound that size on your thigh, people would be like, don't, like, what are you doing? Like, stay home
That's
in bed.
true.
But nobody, it's this invisible wound, right? People don't
Hmm.
see it.
Hmm.
So you have to sort of think through that and think, okay, I need to be home. I need to rest, even though you may feel like you want to get up and move and do and sort of be on society and things. It's important to be resting at that point.
Hmm.
Another thing I really talk a lot about, and it's a huge focus of mine, is scary thoughts or intrusive thoughts.
Yeah.
So, setting yourself up to be supported and understand and really just be sort of like patient with yourself with the mental health aspect.
Hmm.
So, we have these thoughts that like it seems to happen as soon as we get pregnant. I don't. It's a hormone thing and like all these other things that happen, but it's we start thinking like, oh, I walked down the stairs a million times, but all of a sudden now I'm deathly afraid that I'm going to fall down the stairs. Like, why would
Yes.
I all of a sudden think that? I've been able to walk down the stairs my whole life, but now I'm going to think that I'm going to drop my baby down the stairs.
Hmm.
Or you're driving through a certain intersection and you think that some car is going to come crash through, that intersection. You've drove through that intersection a million times, but all of a sudden now you're thinking that. You're cutting vegetables and you think that somehow the knife is going to fly out of your hands and stab the baby. So there's
Wow.
all of these things that sort of come up into our brains that just sound so crazy, and we're like, oh my gosh. And then we hear about things like on the news that there's psychosis, like things, people who are hurting their babies.
Hmm.
And we feel like, oh my gosh, I'm crazy. I'm going to be like them. I'm going to hurt my baby. There's something wrong with me. When really
Yes.
these are very normal thoughts. 90+% of people have them. Actually, the partner also has them as well. So it's something that sort of happens as we move into parenthood. And it's our body, it's our brains just sort of helping to try and protect our babies from all the things that can happen in the world. And we're just trying to navigate, like, what is this,
There's this change that's happening.
I want to make sure my baby's protected at all costs. So I'm going to come up with all the scenarios I possibly can to make sure that the baby is protected. And so, yes, it's hard because we're like, having these visions of things that could possibly be, horribly, detrimental to the baby. But then, and why would we even think that? And so then we can ruminate on those things. We can not sleep because we're worried about those things. We'll change our behavior. We won't walk around the kitchen a certain way. We won't drive because we're afraid of it. We'll bounce down the stairs. So we'll change our behavior around these things as well. So the first thing I really talk about is that if you're disturbed by it, it's good. That's protective. It means that you're not going to do it, right? If it's a good idea for whatever it is, then go to the emergency department. This is an emergency. We have to handle it. But if you think it's a terrible idea and you don't like it, it gives your tummy an ache, and you're just like, oh God, like make that thought go away, then it's good. It's protective. It means that you're not going to do those things. And then I talk about making sure that then you speak it out into the world, and that it doesn't sit and become toxic in your body, right? So either say it to a friend or me or your partner, or I also have people use guided imagery, and so they sort of stick it on a cloud and let it float away, or stick it on a stick and float it down the river. So allow it to just leave the body. So it's not you're not recoverating on it, you're not ruminating on it, you're not sort of focusing in on it and making those changes. You're saying, wow, that was a weird thought. I don't like that. We'll just let it go on and be be what it is. And to take it on, and we're not going to have it be part of us.
Absolutely.
And so I think the more we talk about that, and the more that we talk about that into the world, the more that people are realize that this is sort of okay to have these, go through these changes and have these thoughts, and that then we can normalize it and make sure that people don't feel sort of burdened by them, right? So those are the biggest things I really focus in on, when we're sort of prepping people for that time.
I love it. And, we're highlighting matrescence for those who are just joining us, which is really the portion of most of women's life when they're preparing for motherhood or enter into motherhood, or a few years, we'll call it a year, months or a year after the birth. So we are really focusing this portion of just what are some of the tips that Dr. Michelle Haggerty have for her patients and for those who she coaches. And I love some of the top tips in that a lot of us are focusing on that birthing day of the birth, and focusing on the day of the birth, but not the days after the birth, is like focusing on the wedding and not the marriage. Which the wedding day is great, but just like with the wedding day too, things can happen. My wedding day, the wind was blowing. It was just like everybody almost blew away. But the day before and after was beautiful.
Perfect. I know. Same with mine. Yeah, exactly.
So you never know. Things might change. So it's important to not just focus and put all our energy in the day of, but put the energy into what can happen and prepare for the days after. And keeping in mind that have the support around you. Take the rest that you need. I love, and I never really explained it that way too to someone. When we have the placenta, I mean, it's just sloughed off of the uterus. So you're right, there's a wound that's there. And so although you're feeling great on the outside, there is a wound on the inside that's trying to heal. So allow it to heal. Take the rest that you need. Do not move around unnecessarily. Let the body do its job and try to heal. Just as if you saw that wound on your thigh, you would allow it to heal. This one is the same wound, but it's just on the inside. So I love that analogy. And then also keeping in mind that if you're having thoughts, that we call them intrusive thoughts, which means that they're just popping into your mind. You're not trying to bring it in. It just pops in. And these are thoughts that are changing your behavior, because all of a sudden, like, you feel like, whoa, there might be a harm to my child if I go this way, or if I take this route. But these are the same routes that you've been taking years and years, if not even decades, right? Or if you are cooking and, for some strange reason, our imagination goes wild. And the imagination starts to go wild and thinking that there's going to be a harm to your child. I love the fact that you said, if you are having these thoughts and it gives you a pit in your stomach and you're like, I do not like this, then that's a sign, one of the signs that good. I'm glad you realized that. Now, what are the next steps? Get it out of your mind. So talk it, get it out, talk to either a trusted professional, talk to a family member, the your significant other or your partner. Use guided imagery to get it out, such as I'm talking this into this cloud and letting it float away because I do not want that in me. I don't want those thoughts within me. And then we use that to get that. So the fact that you're having those, you recognize that these are normal and I do not like it, that's a sign that there's a little less likely that you're going through psychosis. Now, if you're having these thoughts and it's not bothering you, but you are feeling that it's becoming more and more intrusive and it's affecting your day to day, that's when you seek the help. If it's getting to the point where you are in a mode what we call like crisis, like I just need help right now, that's when you go to the crisis centers, and all emergency departments are crisis centers. So
Exactly.
you can go there and we'll be able to get to intervene and get you the help that you need. I love it. Righty. So with all of this, there's so much that goes on in a woman's life that we just talked about that, this portion that no one even really highlights,
Yeah.
matrescence,
Yeah.
adolescence. Yeah, go ahead. But matrescence, no. But then they're stacked on top of all of that, in life. A lot of people go through burnout. I know that, sometimes you're going through it, you don't realize it. It might be after the fact. And some people actively like, oh my gosh, like this is it. I'm going through burnout. Let me know. What about you? Have you experienced burnout? And if so, what did it look like for you?
Yeah. For me, it was sort of this realization. I had my children or was in the process of having my kids and doing this integrative medicine fellowship and realizing there's alternative options. And one day, this again, sort of like a moment for me. I had a trusted friend, a colleague who came to me and said, "Hey, can you be the one that takes care of my babies after after I give birth because I'm pregnant and can be their baby doctor." And I was like, and I looked at her and I said, "I can't. I don't like who I am in the clinic. I don't like the way I practice medicine there. I don't like the stress I have. I don't like how I have to sort of disconnect when I'm there. And I don't want you to see me in that light.
Oh, wow.
I can't have you see me there." But then I said to her, I was like, okay, but I have this vision of this practice, this private practice, where I'll come to your home. I'll spend 90 minutes with you for each visit. I will take care of you and your baby, and you don't need to go anywhere. And we'll do all the lactation stuff, all the mental health, all the things. And you'll have my direct text messaging. You'll have direct access to me. What do you think? And she said, "Oh, hell yeah."
Who wants to? We talked about you just push a watermelon through your
yes, exactly.
Get out and go to the doctor.
Yes, exactly, completely. Yes, exactly. Yes. So she's like, yes, absolutely. So it's proof of concept. So she paid me, and then I was able to do the LLC, get the all the things started. And yeah, that's where it started. So I was able to sort of start this practice in a way that felt very authentic and very supported. And I knew that that this was going to be the way for me, because I was providing the care that I wanted to provide in the way that I wanted to provide it, and also the patients or my clients were able to get the support that they needed in the way that was more appropriate for them. So so it just sort of fit. It felt really good.
I love it. I love that you acknowledged it, because it would have been hard to really acknowledge and say that out loud, right?
It was very
I
hard.
don't like the person who I am at that facility in the way that I'm practicing the constraints that I'm having.
Exactly.
But there's this other person in me that is this person, and I want to be able to highlight them and use that person to help to take care of you and your loved one.
Yep.
Wow. Yep. Very, very, very powerful.
It was. And it's been sort of my guiding light since, right? Like it's been something that like, wow, this is because I'm energized at the end of my day. I was not energized before. I was feeling very drained, I felt like I was sort of snippy with my kids. I was, distant with my husband. And now I feel excited and energized by my patients every day, which is totally different than what I was before. So it's very obvious shift.
Wow. Love it. I'm glad that you're able to find that shift and be able to use it, because you're still, a lot of time when people hear burnout, they think that does the person not want to do that particular either specialty, or they don't want to do that particular occupation. Sometimes the answer is yes. And sometimes it's no, I want to do this, just not this way. I know there's another way that I can fulfill my duty to my clients, my patients, or to this world, but it just doesn't have to be in this manner. And so recognizing it and making that shift and finding the way that you can make it work for you and for others, if that's if you're service oriented.
And that's where that shift came from too, is that I was seeing people that I'm so focused on maternal child health, and I was seeing a lot of like 70 and 80-year-old men. And it was like, I love those patients. They were great. I have a heart for them, but it wasn't my passion. It wasn't where I was meant to be. And it was sort of spending my days in taking care of folks and not the way that I, was really passionate about. So, and that's where like lactation and breastfeeding medicine, board certification came from as well. And now being able to really support people sort of in a different specialty, but within family medicine and this sort of very niche kind of focused area. So, yeah.
I love it. How wonderful. Yeah, I love my geriatric patients. They know this too. Yeah. We have a lot of fun.
Yeah.
Alrighty. And okay, so with that, I have my fun question of the day before we end this wonderful conversation. This was very, very, very good, by the way. I loved this convo.
Thank you. It's really fun. Yeah.
But, and I told you ahead of time.
Yeah.
So if you weren't a doctor, nutritionist, can't do yoga.
Can't do yoga. There we go.
Can't do OMT. Not all right, you obviously can't do breastfeeding medicine, lactation medicine, or family med. And let me see if there's anything else. I'll still allow you to travel abroad.
Okay.
Yeah. Because I remember everything.
I was hoping you give me
Alrighty, what would you be? I'll let you go.
I was gonna say like an adventure guide. So I would be doing like whitewater rafting, or like doing like multi-day like backpacking, hiking, and things like that. That would be sort of out in the wilderness. Yeah.
An adventure guide. I love it. I have a couple people that they haven't used the term adventure guide, but they're doing something similar. So we have you guys in a lovely category, because we have the park ranger.
Yeah.
Prepare. So I do have a park ranger. And by the way, for those who are listening, this is my utopia. This is a medical utopia that's building in Dr. Beckford's head, and all of my guests play a part in this utopia. So when you hear me saying I have another person, this is like I'm putting them in the category and said, oh yeah, we're making this really, really great utopia. So now we have our adventure guide, and we have our park ranger that can help, with the adventure guide to make it. And we have a travel blogger, we have a travel photographer, so travel journalists. So it all goes together with that adventure guide. So
I love it.
Yeah. So, for those who are coming to the utopia that I have not built yet, because it's all in my head, you are set if you love adventure.
Love it.
All righty. Before we end this wonderful conversation, I do want to say hello to one of our docs that stopped by, Dr. Abiola Oso. Dr. Oso, the one and only Dr. Oso.
Yes.
He is an emergency medicine physician. If you are watching, he had a lovely, lovely interview and conversation here. You can find him and the rest of our lovely interview online, and we'll talk about that soon. But before we do that, Dr. Michelle Haggerty, people are listening, they've jumped on, they're watching, and they want to know, how can they be part of your world? How can they find you? Let them know.
Yeah, absolutely. So if you're in the Twin Cities out in Minnesota, we will see people in their homes postpartum with fourth trimester doc. It's www.fourth-trimester.com.
Okay. Mm-hmm.
And then, so it's all medical care stuff. If you are outside of Minnesota and outside the Twin Cities, we will do, we can do postpartum and lactation coaching. So education and informational sort of support outside of Minnesota and outside the Twin Cities. I am going to be July 10th having a free postpartum planning webinar or workshop. So for anyone who's interested, please join us there. You can find it in my social media handles and things. I'm at Fourth Trimester Doc on Instagram. I've got a YouTube channel, Fourth Trimester Doc, Facebook, Fourth Trimester Doc. We're sort of all over the place. And so we'll have that sort of advertised there, but we would love to have you, because there's 5 pillars to planning for postpartum. We've got it. We'll get you set up for success. So
love it. Thank you so much. Alrighty, so you heard it here. If you're in the Twin Cities, fourthtrimesterdog.com, you'd be able to have Dr. Michelle Haggerty. She'll come to your home, help you with not just baby, but also you get a you care. If you're a woman, you just and the family dynamics. There's so much that goes into fourth trimester family dynamic. You have the care of the baby and then the care of the mother. So we'll have all of that. I'm coming with you. She'll have all of that. I'll watch. But she'll have all of that available for you. So if you're in the Twin Cities, she does do home visits and care. If you're outside of the Twin Cities, then she'll available for you as a coach, and it's still all available in fourthtrimester.com for the coaching portion. And also on July 10th, for those of you guys watching, she has a webinar that's coming up, how to help you to prepare for that fourth trimester. All of that information is also available on her website and social media handle. She's the Fourth Trimester Doc. Now, I know some people, they jumped on, and I can hear it. I hear you guys telling me and saying all of this, like, oh my gosh, there goes Dr. Beckford again. I jumped on in the last minute. I wanted to hear all this stuff, and I didn't get all of it. That's okay. This wonderful, wonderful conversation is available on our Your Caring Docs website. That's URCARINGDOCS.com. Select podcast. You'll see Dr. Michelle's beautiful face. Download this episode. Send it to 10 of your friends, especially 10 of your women friends who are in Matrescence. They have a cousin, an aunt, a friend who's in Matrescence. There's so much wonderful information that we had in today's episode. All right. Now, if you are looking for a dynamic speaker on stress management and burnout prevention, that is me for your next event. If you want your next stress management and burnout event to be your best event, contact me at Dr. Beckford at yourcaringdocs.com. That's Dr. Beckford at URCARINGDOCS.com. If you go to our website, you can also fill out the work with me portion, and we'll be able to see if we can make your next event your best event. With all of that, we're going to thank Dr. Michelle. Before she goes, do you have any last words for our listeners?
I'm just like, you're worth it. You are worth spending the time, the energy, the space, and asking for help. You are worth it. So don't feel alone. Don't feel like you're isolated or that you need to be. You're absolutely, please be reaching out. We'll support you.
Love it, love it, love it. You are worth it. You hear that? You are worth it. So reach out, get the support that you need, get the proper planning that you need, not just for the wedding day, but for the marriage, right? Not just for the day of the birth, but for the weeks afterward, the day, the hours, the weeks. There's so much, even the hour afterwards. It's like, whoa, what do I do next, right? This is all part of what Dr. Michelle does. But with that, we're going to end today's wonderful conversation. Thank you so much, Dr. Michelle.
Thank you so much for having me. I really appreciate it. This has been fun.
My pleasure. Alrighty, guys, we will see you guys next time with the Dr. Tamara Beckford Show. Bye.